Wait, before you reach for that bottle of antibiotics in your medicine cabinet, there's something critically important you need to know. Something that could change the way you approach infections, boost your immune system, and potentially save you from the dangerous side effects and long-term consequences of antibiotic overuse. I'm about to reveal a natural antibacterial so powerful, so scientifically validated, and so readily available that you'll wonder why your doctor never told you about it. But here's the thing. What I'm going to share with you today could be one of the most valuable pieces of health information you'll ever receive. Before we dive in, I need to make something absolutely crystal clear, and I need you to really hear this. I am not telling you to never take antibiotics. Pharmaceutical antibiotics are one of the greatest medical discoveries in human history. They have saved hundreds of millions of lives and continue to do so every single day. What I am saying is that antibiotics are dramatically overused, often prescribed when they're not necessary, and this overuse is creating serious problems both for individual health and for society as a whole. The natural remedy I'm about to share with you is extraordinarily powerful for prevention, for treating minor infections, and as supportive therapy. But if you have a serious infection, high fever, or symptoms that concern you, you absolutely must see a doctor. Modern medicine and natural medicine are not enemies, they're partners. The smartest approach uses the best of both worlds. Now that we're clear on that, let me show you what could revolutionize your approach to fighting infections. The natural antibiotic I'm talking about is rosemary. Yes, that aromatic herb sitting in your kitchen right now. And before you dismiss this as just another folk remedy with no real science behind it, let me tell you that rosemary has been the subject of over 300 peer-reviewed scientific studies examining its antibacterial properties, and the results are nothing short of remarkable. In fact, some studies have shown rosemary to be effective against bacteria that have developed resistance to conventional antibiotics. This is huge, and I'm going to show you exactly why. Let's start by talking about the elephant in the room: why antibiotics, despite being lifesavers, have become a serious problem. Every year, doctors write approximately 269 million antibiotic prescriptions in the United States alone. Sounds like a lot, right? Well, here's the shocking part. The Centers for Disease Control estimates that at least 30% of these prescriptions are unnecessary. That's nearly 80 million unnecessary antibiotic prescriptions every single year, just in the US. Worldwide, the numbers are staggering. Why is this happening? Several reasons. Sometimes doctors prescribe antibiotics for viral infections like colds and flu, even though antibiotics do absolutely nothing against viruses. Sometimes patients demand antibiotics even when they don't need them. Sometimes it's just easier and faster for a busy doctor to write a prescription than to explain why antibiotics aren't necessary. But here's why this matters so much. Every time you take antibiotics when you don't really need them, several bad things happen. First, you're killing not just bad bacteria, but also the good bacteria in your gut. Your intestinal microbiome, that complex ecosystem of trillions of beneficial bacteria that are essential for digestion, immune function, mental health, and overall well-being, gets devastated. It can take months or even years for your gut bacteria to fully recover from a single course of antibiotics. Some research suggests that certain beneficial bacterial strains may never fully recover. Second, you're exposing yourself to potential side effects. Common antibiotic side effects include nausea, diarrhea, stomach pain, and yeast infections. More serious but less common side effects can include severe allergic reactions, kidney damage, liver damage, and even life-threatening conditions like C. difficile infection, a dangerous intestinal infection that can develop after antibiotic use. Third, and this is perhaps the most frightening consequence, you're contributing to antibiotic resistance. Every time bacteria are exposed to antibiotics, the vast majority die, but a few resistant bacteria may survive. These survivors multiply, and over time, we end up with bacterial strains that are resistant to our antibiotics. This is how we've ended up with superbugs, bacteria resistant to multiple or even all available antibiotics. The World Health Organization has called antibiotic resistance one of the biggest threats to global health, food security, and development. People are already dying from infections that were easily treatable just a few decades ago. Some experts predict that by 2050, antibiotic-resistant infections could kill 10 million people per year, more than cancer currently kills. This is not fear-mongering. This is the reality we're facing, and it's precisely why we need to be much smarter about when we use antibiotics and what alternatives we have available. This is where rosemary comes in. Rosemary represents a completely different approach to fighting bacterial infections. Instead of a single synthetic compound that bacteria can eventually learn to resist, rosemary contains more than 40 different antibacterial compounds, each working through different mechanisms. This multi-pronged attack makes it exponentially more difficult for bacteria to develop resistance. Let me walk you through the science. Rosemary, scientifically known as Rosmarinus officinalis, contains an incredibly complex mixture of bioactive compounds. The essential oil alone contains compounds like camphor, which disrupts bacterial cell membranes, alpha-pinene, which enhances the penetration of other antibacterial compounds into bacterial cells, and cineole, which interferes with bacterial communication systems and prevents the formation of biofilms. Those tough bacterial communities that are notoriously hard to eliminate and cause chronic infections. Then there's rosmarinic acid, a phenolic compound that has been extensively studied. Research published in the Journal of Applied Microbiology demonstrated that rosmarinic acid shows powerful antimicrobial activity against both gram-positive and gram-negative bacteria. This is significant because these two categories of bacteria have different cell wall structures and usually require different approaches to kill them. The fact that rosemary works against both makes it incredibly versatile. Rosemary also contains unique diterpenes called carnosol and carnosic acid. These compounds not only kill bacteria directly, but also have profound anti-inflammatory effects. This is crucial because much of the damage from bacterial infections comes not from the bacteria themselves, but from the body's inflammatory response. By controlling both the infection and the inflammation, rosemary provides a more balanced, holistic treatment. A study published in Food Chemistry found that these compounds were effective even against antibiotic-resistant strains of bacteria, including MRSA, methicillin-resistant Staphylococcus aureus, one of the most feared hospital superbugs. Now, here's something truly remarkable that distinguishes rosemary from conventional antibiotics. A study published in Phytotherapy Research tested whether bacteria could develop resistance to rosemary essential oil, the way they develop resistance to synthetic antibiotics. The researchers exposed pathogenic bacteria to sublethal doses of both rosemary oil and conventional antibiotics over multiple generations. With the synthetic antibiotics, the bacteria quickly developed significant resistance within 20 to 30 generations. But with rosemary oil, even after 50 generations of exposure, the bacteria showed little to no resistance. Think about what this means. We have a natural substance that kills bacteria effectively, but doesn't create resistant strains the way our pharmaceutical antibiotics do. This is incredibly important for the future of medicine. Let's talk specifically about what infections rosemary can help with, backed by solid scientific evidence. For respiratory infections, rosemary is particularly powerful. Studies have shown activity against Streptococcus pneumonia, the bacteria that causes most cases of pneumonia, as well as Haemophilus influenzae, another common respiratory pathogen. But rosemary doesn't just kill these bacteria. It also has expectorant properties that help clear mucus from your lungs and anti-inflammatory properties that reduce swelling in your airways. This makes it a comprehensive treatment for respiratory infections. I've personally known people who stopped a developing respiratory infection in its tracks by using rosemary intensively at the first sign of symptoms. For skin infections, the evidence is equally impressive. A study published in the medical journal Burns examined the use of rosemary oil on minor burns and wounds. Wounds treated with rosemary preparations healed significantly faster, had lower infection rates, and resulted in less scarring compared to the control group. For acne, which is fundamentally a bacterial infection of hair follicles caused by Propionibacterium acnes, research has shown rosemary to be as effective as benzoyl peroxide, a common conventional treatment, but with fewer side effects like dryness and irritation. For urinary tract infections, which affect millions of people each year and are becoming increasingly difficult to treat due to antibiotic resistance, rosemary shows considerable promise. Its diuretic properties help flush bacteria from the urinary tract, while its antibacterial compounds kill the E. coli bacteria that cause most UTIs. Now, to be clear, if you have a full-blown UTI with fever and severe symptoms, you need to see a doctor immediately because UTIs can progress to dangerous kidney infections. But for very early symptoms or as a preventive for people prone to recurrent UTIs, rosemary can be incredibly helpful. For dental and gum infections, rosemary is exceptional. A study found that rosemary mouthwash was as effective as chlorhexidine, the gold standard prescription antimicrobial mouthwash, in reducing oral bacteria and plaque, but without the side effects of tooth staining and taste alteration that chlorhexidine causes. For digestive infections and imbalances, rosemary helps fight harmful intestinal bacteria while supporting beneficial bacteria, unlike broad-spectrum antibiotics that wipe out everything, good and bad. Its carminative properties also reduce gas and bloating, and its antispasmodic action relieves intestinal cramping. Now let's get practical. How do you actually use rosemary as a natural antibiotic? I'm going to give you detailed protocols that you can start using immediately. The foundation of using rosemary medicinally is the properly prepared infusion. This is not just throwing some rosemary in hot water. There's a technique that maximizes the extraction of antibacterial compounds. Here's the optimal method. Use 1 cup of filtered or mineral water. Tap water works, but chlorine can interfere with some compounds. Add 2 heaping teaspoons of high-quality dried rosemary or 4 to 5 fresh sprigs about 10 centimeters long. Place water and rosemary together in a small pot and bring to a full boil. Once boiling, reduce heat to maintain a gentle simmer for exactly 5 minutes. This extracts the essential oils and fat-soluble antibacterial compounds. After 5 minutes, turn off heat and immediately cover tightly with a lid. This is crucial. Many of rosemary's most potent compounds are volatile and will escape into the air if not covered. Let it sit covered for 10 to 15 minutes as it cools. During this time, evaporated compounds condense back into the liquid. Strain through a fine mesh strainer or cheesecloth. For prevention and immune support, drink 1 cup daily. You can do this continuously for several weeks, then take a break for a week or 2. For treating active infections like early cold symptoms, sore throat, or digestive upset, increase to 3 cups daily, but only for 7 to 10 days. Don't continue 3 cups daily long term. To improve the taste, you can add raw honey after it cools to drinking temperature. Never add honey to very hot liquid as heat destroys honey's beneficial enzymes. Raw honey also adds its own antibacterial properties, creating synergy. You can add fresh lemon juice for vitamin C and a better flavor. Some people like mixing rosemary with thyme for enhanced antibacterial effect, or with mint for a more pleasant taste. For topical antiseptic use on wounds and cuts, make a double-strength infusion. Use 4 teaspoons of dried rosemary or 8 to 10 fresh sprigs per cup of water. Follow the same preparation method. Let it cool completely before use on skin. Here's the correct protocol. First, wash the wound thoroughly with soap and water. This is non-negotiable. No natural remedy replaces basic, proper cleaning. Dry gently with clean gauze or a towel. Soak sterile gauze or a clean cotton ball with your rosemary infusion and apply directly to the wound. Don't rub, just press gently and hold for at least 30 seconds. You can let it air dry or gently pat dry with clean gauze. Cover with a bandage if needed. Repeat 2 to 3 times daily until healed. Watch for signs of infection spreading, red lines extending from the wound, increasing redness, swelling, pain, pus, or fever. If any of these occur, see a doctor immediately. For throat and mouth infections, rosemary gargles are remarkably effective. Prepare your concentrated infusion and let it cool to warm or room temperature, never hot. Take a good mouthful and gargle for 30 seconds to a full minute, making sure it reaches the back of your throat. Spit out and repeat 2 to 3 times. Do this 3 to 4 times daily, especially after meals. Many people report significant improvement in sore throat within 24 to 48 hours. For gum disease and gingivitis, Using this as a regular mouthwash can reverse inflammation and bleeding. I've heard from multiple people whose dentists were amazed at the improvement after just a few weeks of consistent rosemary mouthwash use. Now let's talk about rosemary oil, a more concentrated and longer-lasting preparation. Making infused rosemary oil requires attention to safety to avoid botulism risk. The key is ensuring the rosemary is completely dry before adding oil, as botulism bacteria need moisture to grow. Wash fresh rosemary thoroughly and let it air dry for at least 48 hours, ideally 72 hours, until you're absolutely certain no moisture remains. Once completely dry, roughly chop the rosemary and fill a sterilized glass jar about 3/4 full. Don't pack tightly. Pour your carrier oil of choice over the rosemary until it's completely covered with at least 2 centimeters of oil above the top layer. Extra virgin olive oil is excellent as it has its own antibacterial properties. Jojoba or fractionated coconut oil also work well. Use a clean utensil to remove any trapped air bubbles. Close tightly and label with contents and date. For the traditional cold method, place the jar in a warm, dark location for 4 to 6 weeks, shaking gently every 2 or 3 days. For the quick heat method, place the jar in a slow cooker with water halfway up the jar. Set on low for 4 to 6 hours. After infusion, strain through multiple layers of cheesecloth, pressing to extract all oil. Store in dark glass bottles in a cool, dark place. This oil keeps for 6 months to a year. Use this oil on minor cuts and wounds, minor burns including sunburn, fungal skin infections, sore muscles and joints, or massage into scalp for hair and scalp health. For essential oil, which you should buy rather than make, never apply undiluted to skin. Proper dilution is 2 to 3 drops per tablespoon of carrier oil. You can make antibacterial serums for acne, healing ointments for wounds by combining with coconut oil and beeswax, or diffuse in your home during illness season. 5 to 7 drops in a diffuser for 30 to 60-minute periods several times daily can help reduce airborne bacteria. Now, let's address an important question. When should you use rosemary and when should you use conventional antibiotics? Here's a sensible framework. Use rosemary as your first line of defense for minor infections caught early. At the very first sign of a sore throat, the beginning of a cold, a small cut or scrape, mild digestive upset, or early UTI symptoms, use rosemary aggressively. Many times you can stop an infection from fully developing if you act fast. Use rosemary for prevention. Regular rosemary consumption strengthens your immune system and creates an internal environment less hospitable to pathogenic bacteria. During cold and flu season, preventive rosemary use can significantly reduce your chances of getting sick. Use rosemary as complementary treatment alongside antibiotics. If your doctor prescribes antibiotics for a serious infection, take them exactly as prescribed, but also use rosemary. The combination can be more effective than either alone, and rosemary can help mitigate some of the side effects of antibiotics, particularly the gut damage. Some research suggests that rosemary may even enhance the effectiveness of certain antibiotics. However, you should definitely seek medical care and likely need antibiotics if you have high fever over 39 Celsius or 102 Fahrenheit, especially lasting more than 24 hours. An infection that isn't improving or is worsening after 48 to 72 hours of home treatment. Red streaks extending from a wound or infection site, indicating the infection is spreading through your lymphatic system. Deep wounds, especially puncture wounds or wounds from dirty objects. Difficulty breathing, chest pain, severe pain, confusion, or any truly alarming symptoms. Any infection if you're pregnant, have a compromised immune system, have poorly controlled diabetes, or have other serious medical conditions. Let me share some real-world application strategies. For cold and flu season, start preventive rosemary in early fall. Drink 1 cup of rosemary infusion daily throughout fall and winter. Diffuse rosemary essential oil regularly in your home. Increase intake immediately if exposed to sick people. For children's health, rosemary can be used for children over 5 years old at reduced doses. Approximately 1/3 of adult dose for ages 5 to 10 and half dose for ages 10 to 15. This can significantly reduce the number of times children need antibiotics. For recurrent infections, if you or a family member gets frequent throat infections, UTIS, or other recurring bacterial infections, a daily rosemary protocol can break this cycle. Many people find their infection frequency drops dramatically with consistent rosemary use. For gut health restoration, if you've recently taken antibiotics, intensive rosemary use can help speed recovery of your gut microbiome. Use rosemary infusion twice daily for 2 to 3 weeks after finishing antibiotics, along with probiotics and fermented foods. For travel, rosemary is excellent protection against traveler's diarrhea and other infections you might encounter. Start intensive rosemary use a few days before travel and continue throughout your trip. Bring dried rosemary or a small bottle of rosemary essential oil with you. Now let's talk about contraindications and who shouldn't use rosemary medicinally. Pregnant women should avoid medicinal doses as rosemary can stimulate the uterus. Breastfeeding women should use caution as compounds can pass into breast milk. Children under 5 shouldn't use medicinal doses. People with epilepsy should avoid rosemary as camphor can potentially trigger seizures. Those on blood pressure medications should use cautiously as rosemary can lower blood pressure. Those taking diuretics should monitor hydration, as rosemary also has diuretic effects. Those on lithium should consult their doctor, as rosemary can affect lithium levels. Those allergic to plants in the mint family may also be allergic to rosemary. Here's something many people don't realize. The way we use antibiotics in modern medicine is actually relatively new in the grand scheme of human history. Penicillin was only discovered in 1928 and wasn't widely available until the 1940s. Before that, for all of human history, people relied on natural antimicrobials like rosemary, and they worked. Yes, people died from infections, but often this was because they didn't have access to any treatment at all, or because infections had progressed too far. When natural antimicrobials were used properly and early, they were often effective. The problem is that this knowledge has been largely lost as we've become completely dependent on pharmaceutical antibiotics. But here's the thing. We now have the best of both worlds. We have powerful pharmaceutical antibiotics for when we really need them, and we also have traditional natural antimicrobials like rosemary, now validated by modern science. The smart approach is to use natural antimicrobials like rosemary as your first line of defense and for prevention, reserving pharmaceutical antibiotics for serious infections where they're truly necessary. This approach protects your gut health, reduces antibiotic side effects, helps prevent antibiotic resistance, and often resolves minor infections just as effectively as antibiotics would have. Let me give you a specific protocol you can follow starting today. Stock your natural medicine cabinet. Buy high-quality organic dried rosemary or grow a fresh plant. Get dark glass bottles for storing infusions and oils. Acquire high-quality rosemary essential oil and a carrier oil for dilution. Get sterile gauze and supplies for wound care. Start a preventive routine. Drink 1 cup of rosemary infusion daily, especially during infection season. Use rosemary liberally in cooking. Diffuse rosemary essential oil in your home weekly. Create your emergency response plan. At the first sign of any infection, immediately increase rosemary intake to 3 cups daily. Apply topically if it's a skin issue or wound. Gargle if it's a throat issue. Use steam inhalations if it's respiratory. Track your response. Most minor infections should show improvement within 24 to 48 hours. If you're not improving or are worsening after 48 to 72 hours, see a doctor. Know when to seek help. Don't try to treat serious infections at home. When in doubt, see a doctor. Educate your family. Make sure everyone in your household knows how to prepare and use rosemary. Teach children about natural remedies. Share knowledge with friends and extended family. The more people who know this, the less unnecessary antibiotic use there will be. Build relationships with healthcare providers who understand integrative medicine. Find a doctor who respects both conventional and natural medicine. Discuss your use of rosemary with your healthcare provider. A good doctor will support intelligent use of natural antimicrobials for appropriate situations. Here's something else important to understand. The pharmaceutical industry has little incentive to research or promote natural antimicrobials like rosemary. You can't patent a plant, So there's no potential for the billions of dollars in profit that come from patented pharmaceutical drugs. This is why most research on natural antimicrobials comes from university laboratories and international research institutes rather than drug companies. It's not that natural antimicrobials don't work or aren't scientifically valid. It's that there's no financial incentive for the major players in medicine to study or promote them. This means the information often doesn't reach doctors or the public, not because it's not valid, but because there's no marketing machine behind it. This is why information like what I'm sharing today is so important. We need to take responsibility for our own health education. We need to seek out information about effective natural treatments and learn to use them appropriately. We need to be intelligent consumers of healthcare who can make informed decisions about when natural treatments are appropriate and when pharmaceutical interventions are necessary. Let me share some success stories I've encountered. A woman who had been getting UTIs every few months for years, she was constantly on antibiotics, which were destroying her gut health and causing chronic yeast infections. She started drinking rosemary infusion daily as a preventive and dramatically increasing it at the first sign of UTI symptoms. She hasn't needed antibiotics for a UTI in over 2 years. Her chronic yeast infections resolved, her digestion improved, and she feels healthier overall. A man with recurring skin infections. He worked in construction and frequently got small cuts and scrapes that would become infected. He started immediately treating any wound with rosemary infusion and applying rosemary oil. The infection rate of his wounds dropped dramatically. He went from needing antibiotic treatment several times a year to not needing antibiotics at all. A teenager with severe acne who had been on multiple courses of oral antibiotics. The antibiotics would work temporarily, but the acne always came back, and the repeated antibiotic use was causing digestive problems. She switched to using rosemary infusion as a facial toner twice daily and taking rosemary tea once daily. Within 6 weeks, her acne was significantly improved, and after 3 months, it was better than it had ever been on antibiotics, and it stayed that way. A family with young children who were constantly sick with ear infections, throat infections, and respiratory infections. They were at the doctor constantly, and the children were on antibiotics frequently. They started giving the children small doses of rosemary tea at the first sign of any illness and using rosemary steam inhalations for respiratory symptoms. The frequency of infections dropped by about 70%, and when infections did occur, they were milder and resolved faster. The amount of antibiotics the children needed decreased dramatically. These aren't isolated incidents. These are patterns I've seen repeatedly. When people learn to use natural antimicrobials like rosemary intelligently and proactively, they often find they need pharmaceutical antibiotics much less frequently. This is better for their individual health and better for public health by reducing antibiotic resistance. Now, I want to address some common objections or concerns people might have. Some people say if natural antimicrobials like rosemary really worked, wouldn't doctors prescribe them? The answer is complex. As I mentioned, there's little financial incentive to research or promote them. Additionally, medical education is heavily influenced by pharmaceutical companies. Most doctors receive little or no training in herbal medicine or natural antimicrobials. It's not that doctors are bad or don't care. It's that they prescribe what they've been trained to prescribe. However, this is slowly changing. Integrative medicine, which combines the best of conventional and natural medicine, is growing. More and more doctors are becoming interested in evidence-based natural treatments.